Now, if you're suffering from gum recession and are concerned about your dental health, then you should know about a new clinical study happening at the School of Dental Medicine at UB. Now, Dr. Othman Shibli is a clinical professor at the periodontal department there, and he is here with details this morning. Good morning, Dr. Shibli. How are you?
Good morning. Thank you, Courtney, for inviting me here.
Well, welcome to AM Buffalo. To start off, let's define gum recession. What is it exactly?
Gum recession, the gum should cover the teeth in an aesthetic way, but sometimes due to severe brushing, hard brushing, or due to gum disease, the gum will recede it from the teeth all the way to the root of the teeth, showing then the teeth will look ugly because they look longer than usual. And this is related to periodontal disease and bone loss and severe brushing. People, they brush hard, so they don't only remove the plaque, but they remove the enamel, the cementum, and they remove the gum from their teeth. And that's become a big problem, and there are around 30 to 40% of people, they suffer from gum recession.
Yeah, so if this does happen, what are some of the risks of leaving gums untreated?
Yeah, one major risk, if this was left untreated, is the recession will continue to happen. Bone loss that support the teeth in place will continue to advance to a point that the teeth, there's not enough support for the teeth, and the teeth become loose. And in very advanced stages, people may lose their teeth because there's no more support. And also beside the people, elderly people, because now people, they get a lot of medicine. People elderly, some of their medication cause dry mouth, xerostomia. And exposing the root, because of the recession, they get root caries. So people will get root caries. They get also root sensitivity to hot and cold. And now we are coming to the summer, so then they cannot eat or ice cream or something. So all this may happen, as things advance, if left untreated.
And it's amazing you think if you're brushing your teeth really hard that you're making them cleaner and cleaner, but that's not the case. You're actually harming your gums.
Exactly. And some of people who treat them, their teeth looks nice and clean, but the gum receded.
Yes. So let's talk about the research project you were conducting at UB. What have you been working on?
Right. So the traditional way that has been proven for 30, 40, 50 years that works is what we call the connective tissue graft, where we take a piece of the gum from the roof of the mouth and we put it in the area that this recession, and it gives excellent result. We have long history of success. Now, Dr. Chow invented a new technique. It's called pinhole technique, where you don't need to take from a piece of the gum from the roof of the mouth. So it is only one procedure, not two procedures. We, as scientists, when we see something like this, we like to investigate and see how good this is. And because we have a good feeling that this is something good, we need to see how good compared to the traditional way of treatment. So what we are trying to do now in Buffalo, inviting people to volunteer and participate in our clinical trial, where a patient will receive in one part of their mouth that our traditional way, which is the connective tissue graft, and in the other side, same patient will receive the pinhole technique. This way we can have honest, truthful comparison between the two techniques and report this and give the public the research valid opinion about these new advances in dentistry and in gum that will help not only to protect the teeth, but also to make people look, their smile look better and nicer.
Let's take a look at some of the pictures that you brought here today. Now, these are some of your patients. As you can see, what are we looking at right now?
Here, where the gum looks normal and healthy, you can see the gum, how it looks nice, hugging the teeth in a nice way, and no disease, nothing. Here you can see how the gum receded, where not only the white part, which is enamel, appears, but also the yellower part, which is the root. And that's then will be, patient will suffer from sensitivity, and sometimes, especially elderly people, from root caries. And so our purpose is to move this patient from this way in the treatment to, we can go back to the first picture, to a healthier way, the way we saw here. That's our goal and our purpose.
All right, well, thank you so much, Dr. Shibli, for joining us here today. Potential patients, you can call their research assistant, Michelle, at 829-2885, or email her at ambessing@buffalo.edu. And thanks again.
Thank you so much.